Well, Parliamentary Standing Committee on Health has asked the Union Health Ministry to conduct an audit on COVID deaths pertaining to oxygen shortage in the second wave. The panel has called for more transparency and accountability from the government agencies. The panel used stinging words, saying they were disappointed by the utter ignorance of the government. Nakul joining us with more inputs. Nakul, this is again a very important aspect that we are tracking here on Mirror Now. It is, after all, with regards to oxygen shortage in the second wave, which caused bulk of COVID deaths. Tell us more about what the Parliamentary Standing Committee on Health has observed in this regard.
Well, absolutely. And as we all are aware that the second wave, which was spreading like a wildfire, had seen more and more fatality rates, not just in the people who had comorbidities, but in the in other patients as well. But this is very important report that the Parliamentary Committee had given out, and which it had reprimanded the Ministry of Health. And this is given to understand this is the 123rd report which has warned the government that there are oxygen shortages in the hospitals. Now they have also asked the government to conduct the audit audit in this particular matter of the deaths due to oxygen shortage. While at the same time, they have also said that there is a disappointment on the part of the committee towards the ministry when ministry had submission in the 2020 which assured that country is self-sufficient in terms of oxygen and oxygen cylinders. However, they have in their report had said that the promises that were made, or the submission that was made, was disappointed. The committee found that there is a disappointment in the promises that were made. Now, at the same time, what we are given to understand is that they have also ordered an audit in coordination with the states to conduct the audit and find out what was the exact data was. Now, at the same time, they have said that during the second wave there was a shortage, especially during when people, not just the people were struggling with comorbidities, but in the other patients as well. And this is the findings of this particular report that has been submitted by the Parliamentary Committee. Now, at the same time, the ministry, which is important now, that they have asked in coordination with the states that the ministry should audit the deaths due to oxygen shortage and enable the documentation of the COVID deaths that will, in fact, generate the response and responsible sense of the government. Now, these are the lines on which the Parliamentary Committee, they have suggested that the audit must be done.
Yes, of course. This is important, and thanks for giving us all the important details, Nakul, on this.